May I introduce you to our special guest, Mr. Stepherd Nhariwa. Good afternoon, Mr. Nhariwa.
Good afternoon, Anu. Thanks for
Hi.
having me on the show.
Thank you. It's my pleasure, honestly, having you in my show. I would need to introduce my guest in a few more words. He is a specialist CAMHS practitioner and a mental health awareness consultant. Without further ado, I would want to know everything from you, Mr. Nhariwa. For us, for a layman like us, the concept of mental health is quite blurry. I know we are becoming more and more aware, knowledgeable of the situations that happen when you are ailing with mental health problems. But do we really understand when can it strike you? What can happen? What will you face or feel? We are not aware of, I believe. So if you can take us through this journey of understanding, and what age group can it first strike you? All about that from you, please.
Sure. I mean, usually mental health, like you said, in most cases, there is quite a stigma about mental health. A lot of times people really don't fully understand what it means to have mental health. Like you say, I think the best way to kind of describe it is put it in layman's terms. It's a condition like any other illness, or when someone is not well, where a person can be affected in so many different ways, particularly. Now, obviously, when we talk of mental health in terms of age and so forth, I think it can start from any particular young age. I mean, it does affect children from a very young age to start with. There is evidence that from as young as 5 years old, a child could face some mental health difficulties. Now, it is a condition that's mostly linked with emotions, how a person feels, etc. So I think to try and sum it all up, really, I would say mental health is more in relation with people's feelings, the mind, how they're thinking, how they're feeling. For example, when we hear of depression, that is another part of mental health that is within the realm of all the issues around mental health. So if one was to ask what mental health is in general, we talk about, for example, there is the natural state like sadness, which is a normal thing. But when it gets to the point where it's affecting you in your day-to-day lives, you are on a downer, you cannot really focus, you can't think, you cannot be bothered to get out of bed. There are some issues that affect a person, or should I say an individual, male, female, whatever background you're from. So it has nothing to do with status in the sense that it only affects certain people. No, it can be anyone from any walk of life. I hope I'm making sense so far.
Yes, I do
Yeah,
understand. So it can be people from
yeah,
any age group, it can be people from any social
yes,
scenario, from any
yes,
background, cultural background. It
yeah,
can be absolutely anybody
that's right.
from anywhere who can be affected, but we may
That's
never
right.
know about it or might know about it
Yes.
much later.
This is the thing about knowing about mental health. Sometimes it is very difficult to actually understand what is happening to us. I say
Yeah.
us because I
Yes.
myself could potentially get a situation where I have mental health issues that I might not be aware of, or you
Yeah.
yourself could have certain mental health issues you might not be aware of. But
Yeah.
what's clearly important is to identify why you're being a certain way that you haven't been before. For example, why people become very depressed, for example. I want to use depression as one particular example, if I may,
Yeah.
because people kind of get to a point where they are affected by some events in their lives for some reason, and that may potentially cause them to be very low in mood, to the point where some people can be affected greatly, such that if they don't seek any help, they may actually deteriorate to a point of even having suicidal thoughts. So
Oh,
again, issues around suicidal thoughts, that's another part of mental health that
mm,
can be exacerbated by so many different factors. So when we talk of mental health, it's a very broad topic, I think, and it's
yes,
something that we have to analyze quite, carefully, and also identify with what is deemed as mental health, what can be termed as mental health.
yeah,
Someone can say my mental health is fine. I have everything I need. I have food, shelter. I have a job, or I have family, and so forth. And in some cases, that particular issue of approaching professionals to seek help is not always straightforward.
yes.
Sometimes it's about the acceptance. If the acceptance is not there, if there isn't any kind of identification of it, we are nowhere close to finding out what is going on.
Yes, yes.
So
Uh,
it is quite broad, like I said. Yeah.
Taking it from your explanations, taking it from what you say, let us point
Yeah.
today on a certain situation that we are
Yes.
in at the minute. We are in a very
Yes.
depressed social and mental
Yes.
situation at the minute because of this
Yes.
pandemic, which has been a part of our lives
Right.
for last 8 to 9 months. It was
Yes.
first in the early January when the signs of COVID started to show up in this country. And by the time we were in the end of March and April, the lockdown had already started. So it's been really long. A whole year is going by where we are kind of restricted from doing many things which we would rather class
Right.
under normalcy. This particular,
That's right.
and now as we were talking about different age groups who can be affected by, by mental health conditions, obviously the elderly who have been kept away from their family for different reasons are suffering. But there's another
Yes.
age group who are really traumatized, and we know very little of that because we believe, oh, they have everything, access to everything. They should be the happy lot, but they are suffering, and that
Yes.
is the youth. Please shed
Yes.
some light on this, the mental health
Yes.
conditions and the youth. Looks like
Okay.
this year has been devastating for them. So, what's your opinion
Yes.
about it?
Right. I think when it comes to, yeah, like we say again, in general, mental health across the board affects many different people. But in terms of the youth, I would say, because if you can imagine the youth being quite active before the pandemic, for example, youth being quite active, being involved in all sorts of different activities that they may have been involved in prior to the pandemic, and all of a sudden the lockdown starts or the lockdown sets in, they're then having to be forced to be indoors for most of the time. Now, if you can imagine, I don't know about you, but if you can imagine just being locked in your home, not being able to go out, socialize, and carry on as normal with life as you would normally do, that in itself would have quite an impact on our mood. So mood plays a great part in it. So sometimes the mood gets to the point where young people have nothing much to do, or a lot of negative thoughts start to kick in, where they feel I can't do what I used to do, my livelihood's been taken away, I'm struggling to cope with all this. So it just be triggered by a situation where maybe some might resort to taking substances, for example, or alcohol, you know, and get to the point where that in itself triggers uh, some mental health issues that may start to develop from that as well. But if someone is literally in a situation where they are feeling so low in mood, that is particularly where the problem begins.
Yeah, because
The
you have
young
been
people
working so
will
closely with
usually,
the young. I would also like to
indeed,
know,
yes,
yeah, the pandemic has caused a lot of panic, and there's been death in many families and a lot of grief around this. So,
yes,
have you experienced these things affecting the youth really badly?
yes,
Have you come across people who
yes.
have suffered from this?
Yes, I mean, generally, usually, prior to the pandemic situation, I mean, you would have situations where young people, I've worked closely with young people in a capacity as a mental health professional, doing assessments. Usually, assessments for young people, mental health assessments, to be quite specific, are usually done when a young person has been referred by their GP, for example. So that means they would have presented with a difficulty, or it might not necessarily be themselves presenting themselves to the GP, but it could be a family member or someone else from the school, for example. If it's a child or young person that is still in school, what tends to happen is the teachers might notice something different in their behavior, in their presentation, how they act, and if there is an element of risk identified, it really then triggers a referral to a GP, for example, and that GP then would have to also put it across to the mental health teams that are specific to that young person's area, and they arrange dates. So I'm trying to describe my involvement in terms of, so I would be part of, say, for example, a team that would be doing the assessments for young people, what we call the Child and Adolescent Mental Health Services, or CAMS, as it's not mostly known. So you would then get that referral put across to the team. We then obviously uh, go through that referral. Sometimes it's just screened out whether it's a mental health issue. Is it worth getting the young person and their family in to sort of get more clarity on what has been happening? Because usually there are events that trigger the situation to happen, if that makes sense. So, for example, if the young person has been, some young people start to present in such a way that is quite risky, where sometimes the young person may not have an idea of why they're being the way they are. So, for example, if they stress, some may start to self-harm. That is something that I've seen quite prevalent amongst young people, and it could be potentially because of issues that have been triggered by the pandemic situation. I'm trying to just speak from a general term. Obviously, I can't share any specific
Yes,
experiences
yes, I can understand.
mentioned. Yeah.
So,
Um, so you
I'm
would,
interrupting you here, and I'll
that's
put
fine.
in another question, which probably would be a part of this. During the pandemic
Yes,
situation, the GP has not been
yes,
able to work very normally. They had to take
yes,
special care. Energy was being dedicated to taking care of people who are affected by COVID-19. Uh,
yes.
so during this situation, have you come across such mental health assessment situations which have been passed forward from the GP, which were triggered by the COVID or some kind of, death or crisis at home, which has been extremely serious or of a very different kind from what you experience normally?
Yes, I think the issue around death in the family as a result of someone who within that family who would have died from it, and that in itself has quite an impact on young people. Such cases have been raised, and usually it is more about offering. the support that's appropriate for that particular individual, how they are feeling. So we obviously look at what is affecting them apart from the obvious. Any death situation, an issue of grief would affect us all really under
Yes.
normal circumstances. But
Yes.
I think there is more, so much of that grief uh, continuing to the point where it leads to a particular young person becoming really, really distressed to a point where it affects their mental state drastically. So
Yes. So, what kind of mental
that's,
ailments
yeah.
have you come across during this time because of COVID-19?
Um,
What are the more prominent mental health issues in the youth at the minute?
I think you kind of get more of the issues centered around the grief, the depression in itself, low mood, particularly.
Yeah.
I think there's been more of uh, a noticeable, kind of change in terms of how issues are presented, basically.
Hmm. Okay.
Yeah.
So, you think depression and very low mood are the two mental conditions that are very prevalent at the minute?
Yeah, they're quite likely to be, yes, at the moment, I would say they are. But I think when people hear low mood, someone can say that's not really mental health. But in actual fact, it does make a major contribution to what is a major factor
Hmm.
towards, you know, deteriorating
Yeah, so
mental wise,
prolonged
mental
low
health
mood
wise.
can be a sign or of mental health. Do you mean so?
Yes, yes, that's true. Yeah, I mean that's something that can considerably bring so much pressure and stress to the point where people are struggling to cope. For example, if you picture the situation as it stands, if say a young person has been having a life where they've had both parents working, for example, and for some reason some parents have lost their jobs inevitably due to maybe the circumstances in relation to, and changes start to take where unexpected things are happening within a household where the income is not as it was before. So
Mm.
as you can imagine, a young person is likely to be, heading down the route of some sort of downward spiral
Mm.
where they are really low, become depressed, they are stressed. And if they don't seek help or support or they don't talk to someone, when we talk of support, we're talking about just being able to vent, I suppose, being able
Yes,
to talk about how things are affecting them, if that makes
yes,
sense.
yes.
Yeah.
That very much makes sense. Another question that comes to my mind at the minute is mental health uh, around panic. We all are suffering
Yes.
from that, but probably as adults, we are more able to cope with it because we have many more things to
Yes.
do. However, panic stricken
Yes.
we may be, we still have to go on. We have to feed our children, we have to feed our family, we have to work,
Yes.
we have to do whether it is the household chores or your regular day to day life, your work, whatever it be, we have to take that on. But with the youth,
Yes.
sometimes such situations, which is normally being seen, many have complained that this panic has created a bubble and it is difficult for some of them to come out of it. They're so panic stricken.
Yes.
Is
That's
it
right.
because of the family? Is it because of the, I should not say media, we are part of the media, but the facts that are coming out is also contributes
Yes.
towards this panic, and they are so
Yes.
young, unscratched minds that they might not be able to balance it well. um, what are your opinions about it? I mean, is panic really
Yes.
being one of the major reasons of triggering this mental health issue in the youth?
Yes. Yes, definitely. Panic, I would say, would be quite a major trigger, really. I think you spoke about media. Media does also play a part because if you can imagine a young person that starts to see the news, and there's more, as you and I know, there are more cases of deaths being highlighted on the news. People who are, taken ill, and sometimes just to a young person, even if there is a possibility that that person will come through healthier again, after they've been given the treatment they need, some look at it completely from a different perspective, as a doom and gloom kind of atmosphere where, what's going on in this world, I don't want to go out there, I don't want to touch anything, I don't want to be, mixing with people out there, because the chances are that I'm just going to get it. So some already probably had some issues they were dealing with prior to this whole pandemic. And then all of a sudden, here it is, this pandemic comes up, something that has changed the world in the way we do things, the way things happen. All of a sudden, you are then restricted in your activities. You are also put in a position where you have this fear that you could potentially die. Some people have that fear.
It could be very difficult for the young to take the pressure of this inevitable death.
Yes, exactly. So if you talk to a young person who might have seen a lot of the news when this pandemic first started, as we all know, there was more panic in the initial stages than there is now, maybe. Because now I think we've kind of adapted to some extent, haven't we?
Yes.
So now, if you can imagine a young person that still has so many those questions that have not been answered. They wondering, is this going to end? Is there anything that's being done to ensure that we are safe? They might see the news and think, "But hang on a second, what they're saying there is not particularly conclusive of what they have done to resolve this whole issue. So what does it mean for my future? Am I going to complete my GCSEs? Am I going to go to university?" I have a son at the moment who has just started university, and I think he also, to some extent, might have had his own anxieties. So if you can imagine, if families are not taking time to support each other, talk to each other, there could potentially be so much difficulty in how it's managed. So if you can imagine someone that already, I'll give an example of a condition again that is also quite prevalent amongst young people, OCD, obsessive compulsive disorder.
Yes.
Yes. So that in itself is another condition that is a part of the whole mental health sort of umbrella, where a young person might, under the circumstances we currently have, might actually be more afraid of contact with the world if they already had that condition. So if you can imagine the mental state they might have at some point, and if it's not managed well, that could really spiral way out of control. If you know what I mean. So it's about managing that.
What are the measures of intervention? Is there enough intervention? Is there enough? What should I say? Or treatment available to them?
Yes, I mean, treatment is there. I think the question arises as well: is there enough? Is there enough support? Are they getting the right resources to cater to the needs of what's needed out there? Now, a lot of people have this thought that there will always be somewhere you can go for a situation that's been presented, but it's not always the case, because it's also affected by how we perceive it as a cultural kind of community. Like if you look at the cultural side of it, we may have specific communities that may completely see mental health in a different light, or may not see it at all, if that makes sense.
So you have been working very closely with the BAME community, isn't it?
Well, across the board, what I've kind of tended to work with is community from all different sides, really. But yes, looking across the board with different communities, different age groups in that sense, where a lot more has been noted that some not see the need to be given the opportunity for treatment, if that makes sense, especially where a diagnosis is quite definite. Some families may not look at it as a problem,
Yeah.
but
Now, why
however,
I brought
as
you
a
on to BAME is because today's topic is COVID-19 and mental health amongst BAME youth.
yes,
So
yes,
I needed to bring it there to
yeah,
understand there
mhm,
seems to be a disparity
mhm,
in the kind of mental health treatment that they are accessing to the BME community. Is it
yes.
because of a loaded stigma around it, or is it that they are not appropriately aware of what mental health issues could be? Is it the family or the cultural or the community pressure that's keeping them away? What are the different reasons you see from your place?
Yes, from my view, from my sort of observations, really, I've noted that there tends to be more of maybe a lack of awareness, I suppose, if I put it that way, because it would be wrong of me to make an assumption that's quite generalized without
Yes.
knowing the facts, But when cases are presented, uh, it is a question of the background. Yes, so for example, in the communities that may not have fully been aware of what's on offer, for pure reasons that they could potentially be new to the country, new to the UK, for example.
Mm-hmm.
They've come from other parts of the world where mental health is not particularly given the support that they might get here, if
Okay.
that makes sense, in England. Yeah. So there is a bit of both, really. If you think about it, the cultural differences, the cultural views, and also a community resource not being fully accessible sometimes because they've not been made aware of it, for example, you
Mm-hmm.
know. So, and again, sometimes there's a barrier in communication, language, for example.
Okay.
Language in itself can play quite a
Vital
part.
role. Yeah.
Yes, yes, because if that in itself is not particularly in the mainstream, if it's not being broadened to be inclusive of those that may not be getting as much, you know, support, it
Mm-hmm.
can potentially, unfortunately, leave them almost feeling like they're left out, or they may have a situation where they deliberately avoid the system,
Yeah.
avoid the mainstream support. So the support is there across the board for everyone
Yeah.
from the different backgrounds, etc. But I think it's about more outreach being needed, I suppose, to ensure that things can be accessed a lot easily. Now, when it comes to young people, I've always taken a view that there might be a need to do more in schools, for
Mm-hmm.
example, give more awareness and training to the teaching, institutions, like universities, colleges. I know for a fact now there are quite a number of universities across the country that are now offering um, a mental health specific, a role. There's a role of an individual that will give, or individuals as a team that will give specific support to young people who might be faced with all sorts of issues around
Yeah.
mental health. Now,
Which means
with the
that the
back to the
awareness is being increased.
yes, I think so. But I think obviously with all sorts of different teams being involved, there is room for more creativity in how that can be broadened. You know.
That's a wonderful way of putting it. Actually, different creative ways of putting it through to them.
Yes.
Yes, they should not feel that they are
Yes.
classed or something very
Yes.
abnormal is happening to them, but they should be able to access and
Yes.
their queries, their situation should be answered appropriately, so they don't feel
Yes.
left out. A lot can be done, honestly. Yes, a lot can be done.
Yes.
Um,
And I
we
think the
ourselves
danger
can feel about it.
sometimes is
Yes.
yes. Sorry to interrupt you. Yeah, the danger sometimes is that there can be so much of the fear that I will be judged if I present myself out there as someone with a mental health issue, or if I say this is how I'm feeling, how am I going to be taken? How is that going to be,
Yes.
accepted? Is that going to be accepted?
Yeah,
Is
there
it
can be a lot of things.
it's
Peer pressure,
family, yeah, peer pressure, yes, and
social pressure.
sometimes,
Yes.
unfortunately, there are also cases where some young people access mental health for the wrong reasons. Some might
Okay.
actually think it's because a friend of mine has started self-harming, for example. Therefore, it could be some sort of thing that, or there are people who can view mental health as an attention-seeking situation, which it is not.
Oh,
It isn't,
okay.
but it's how that is brought across. Do you see what I mean? So it's
Yes.
how that is presented. What is the major problem? Is there a risk? So mental health professionals will always look at those things based on their expertise. What has been presented, how is it affecting the person, what can be done by themselves without tapping into the mainstream resources that are available. Because sometimes you look at situations that do not necessarily need to be presented to the child and adolescent mental health services. But once they are presented, it is up to that team to decide whether it is something that needs to be pursued further. Is there a risk? So if I'm a professional, my main concern would be, is there a risk with this young person? Is it a mental health condition, or is it behavioral? Some of the issues could be just behavioral issues that have not properly been managed as well as they could have been within the home
Okay.
environment.
So, what could be the worst
Yeah, yeah.
risk you
So
look
there are
at?
all sorts of reasons.
What is the worst kind of risk that a youth may be facing or may tend to take their mental health condition into? What could
Mm,
be the trouble that we as a society could face if the mental health of the youth is not being, monitored,
yeah,
groomed, taken
yes.
care of properly? What could be
Yeah.
the greatest risk?
I think for me, the greatest risk really would be for any mental health situation going unnoticed without it being presented in any way, where because a lot of young people tend to obviously hide what they've been doing from their families or friends, or it takes really a lot of bravery to finally present how you've been feeling and what's been going on. So it's all about how we observe as people, as a community, as families, how we observe the behaviors of our young people, for example, um, behavior of each other, really, in terms of how they present themselves.
Yes.
If things go unnoticed, for me, that would be the major risk, in the sense that potentially there is a risk if someone becomes a danger to themselves or to others potentially.
Or to
Because,
others.
yeah,
Which
when
again
they
leads
are,
us to the question that
yeah,
can that lead to some kind of criminal activity? Because
yes,
that has been
potentially it can.
often linked. That has been often
Yes,
linked. And so
it
it's
can.
really, really
If,
demeaning to say, but have to state the fact that this COVID, mental health, and
yes,
crime, somewhere they are
yes, yes,
getting tied because it is a
yes,
long, long,
unfortunately,
long time that we are into this. So,
yes,
this COVID
yes,
causing some kind of mental health issue and that taking to a
yes,
kind of a criminal tendency. How far do you think
yes.
that is justified, correct, or I mean, is there any chance of that actually?
Well, there is a chance, especially when you talk of crime, there is a possibility, yes, that certain situations can lead to, that sort of criminal mindset, if you like. Particularly if someone has never been like that before, but from nowhere, then it builds up into something that obviously causes a major concern. So the key thing there is to be looking at preventative approaches as well. But again, you don't know something's happening until it has happened, for example.
Yes.
So if someone has then gone and done something that is criminal based, it's because there is probably an underlying issue or underlying issues that have led to that happening. So comes to how someone perceives a problem. I mean, some will say, right, this is something they've done because of something else, you
Yeah.
know. I would certainly say, in answer to your question, that there is a link in some cases to certain things happening, which is why you find there are professionals like, uh, criminal psychologists or clinical psychologists that sort of deal with issues around the mental health realm. They work within the mental health teams to try and establish why behaviors have been, exhibited, and what sort of criminal behavior, if you like.
Okay, sorry, Mr. Nhariwa. There was a bit of a disruption in there in the last bit of your sentence. We couldn't hear you very clearly.
Sorry,
So if you
sorry.
would like to repeat
Yeah,
yourself.
I was just saying that. So sometimes you'll find that there are teams that particularly focus on issues around, um, criminality, if you like. If someone has been sent to hospital, like a mental health hospital, for example. I mean, with young people, there is the youth offenders, uh, sort of settings where they are given the support they need. I mean, there is also uh, within the adult services, they
Yeah.
have the forensic mental health services,
Yes.
in which I've also worked in that environment before previously. But you'll find that a lot of the young people would have committed quite a great number of crimes,
Hmm.
that have led to them being admitted into hospital, so that uh, treatment options can be explored.
Okay. Yeah. So I'm just 1 minute to finish the show, and I would like to thank you, Mr. Nhariwa. You have given us a lot of idea about what mental health can be, and specifically mental health conditions in the youth. This is something we do not
Yes,
consider very often. But we should be extremely,
yes,
extremely aware and keep our eyes open towards it. If your family, and most of our families do have young people amongst us, we should keep ourselves open to listening to them, give them
yes,
more time, or be careful about what activities they are involved in, their mental
yes,
situation at the minute specifically. They might be feeling extremely low, they might not be able to meet their friends, which is again dangerously or should I say, I should not use the word dangerous, but they are feeling extremely low. They are under the pressure of their school or college, and what will
mm,
happen to their career now, and they are not able to meet their peers. So everything is taking them down every minute. So we should be of greater help. We should know that there's help around there if we want to reach out to, if we take the right decision at the right time, and if we are
yes,
able to explain to our young generation that
yes,
the budding generation, I must say, they are the future of the
yes,
world now. If we are able to tell them that there is absolutely no stigma in it, to
yes,
speak about it, and to want to ask for help if needed. It is okay to cry, it is okay to be sad, and it is okay to speak about There's no point staying
yes,
gloomy for a real long time.
yes,
You can talk about it, and if needed, if you keep feeling the same way for a very long time, it is necessary that you ask for help, and there's absolutely
yes.
no shame in it. So with
There is help out there. Yes,
yes, there
definitely.
is help
There,
out there. There is absolute
they've
help
got
out
to,
there.
yeah.